Good afternoon, all. On behalf of Department of Panchakarma, I welcome you all in the seventh series of this evidence-based Panchakarma this lecture. And I welcome today's speaker, Dr. Praveen B.S. sir. As in Panchakarma, he has done a lot of work in Panchakarma. So I welcome you, sir. And many teachers, my Dr. Pratik Madnaik sir, I welcome you, sir, in this series. Always you join, and every lecture I could see you. And all dear students from different parts of India who have joined this lecture series, I welcome you all as the head of the department Panchakarma, Faculty of Ayurveda, IMS, BHU. And for the introduction of today's speaker, I invite our student, Dr. Varuni Agarwal, to introduce Praveen sir. Over to you, Dr. Varuni.
Thank you so much, ma'am. Good afternoon, all present here. With great joy and a deep sense of respect, I take this opportunity to welcome our today's guest of honor, who embodies excellence in the field of Ayurveda, Dr. Praveen sir, currently Medical Superintendent, Associate Professor, and Head of the Department of Panchakarma at AIIA, Goa. Dr. Praveen sir is a highly respected figure in the field of Ayurveda who brings with him a wealth of knowledge and experience. He has previously served as a Vice Principal and Medical Superintendent at Sri Jayendra Saraswati Ayurveda and Hospital, Chennai. And while being a member of Academic Council and Board of Studies of Undergraduate and Postgraduate Studies, with his academic excellence and mentorship, has shaped the careers of countless students and practitioners. Beyond his academic and administrative roles, Sir is a prolific researcher with over 40 published articles. He has conducted many training programs under NRHM program and been a part of many CMEs and workshops. His accomplishments and contributions have earned him wide respect, and for the same, Sir has been awarded with Agni Vesha Award, one of the renowned award in Ayurveda. Sir, your presence is an inspiration, and we eagerly look forward to your insights on today's topic, application of Agni concept in Panchakarma. Thank you so much, sir, and we all welcome you. Over to you, sir.
Let me take this opportunity to thank Dr. Rajkala ma'am, who is herself a very pioneer in the field of Panchakarma and Ayurveda. And for giving this opportunity, it is really a privilege, and it's my pleasure to be on this platform to share some of the knowledge which I have gained in my journey of Ayurveda and Panchakarma. Having said that, these kind of the lectures and the thought-provoking lectures are very essential, and I personally believe that this may not be like only one-sided lecture. I would expect more questions from many of the people, or maybe the Tadvidya Sambhasha kind of thing that is very essential. It is very difficult to gain all the knowledge in only a stipulated time in which we work in this field of Ayurveda and Panchakarma. So with this, I would like to share my presentation. Kindly allow me to share my screen. Today, as the topic which has been given to me is the application of Agni concept in Panchakarma. As everyone knows that Kayo Nama Agnihi Tasya Chikitsa Kaya Chikitsa. So first and foremost branch of Ayurveda in Kaya Bala Gruhodvanga Shalyadamsha Jara Vrashan. So in that 8 varieties, 8 branches of Ayurveda. First branch, which is of very immense importance, that is Kaya Chikitsa. The importance has been highlighted as Kayo Nama Agnihi Tasya Chikitsa Kaya Chikitsa. And when he speaks about this one, highly rating this concept of Agni and Tasya Chikitsa, the Chikitsa of Agni itself is considered as the utmost importance. And we look into the Shastra, there are so many different varieties of explanations we do get. And that very important one is that in the 8th chapter of Charaka, Vimanasthana, he explains about this, what is the purpose of treatment and how do you make sure that the treatment is done successfully. So in that he explains about this Karyam Dhatu Samya. So Dhatu Samya is the very important point that we need to achieve at the end of the treatment. And when we speak about this Dhatu Samya, how do you make out that the Dhatu Samya has happened? In that he gives a big list in that Rugopashamanam, Swaravarna Yogaha, Sharira Upachayaha, Balavriddhihi, Abhyavaharya Abhilashaha, Ruchir Ahara Kale, Abhyahurta Aharasya Kale Samyak Jaranam. And at the same time, Vata Mutra Purisha Reta Sammuktihi. So these are very important factor that is being highlighted. In that, very important thing that we need to understand is that related to that of Agni, there are three important factors which are explained. That is interest to consume the food, increased taste towards the food, and a proper digestion of food in stipulated time, or whatever the time which the person is supposed to take the food. Person is getting very good hunger, and whatever the food which is being taken, that is undergoing digestion. Why am I speaking about all these things is that because it is very important to know that the total treatment protocol what we are planning towards is having the main aim to achieve the Agni Vriddhi. And when the Agni Vriddhi happens, then naturally the disease will get cured. At the same time, you will have a very prolonged life without any disease. Same kind of explanation, or I would say similar kind of explanation, you do find in other context of Shodhana, because we are speaking about the Shodhana, context of Shodhana and Panchakarma. In that, it is a very familiar shloka that evam vishuddha koshtasya kayagner abhivardate vyadeshta upashamyate prakritischa anuvartati. Very importantly, the first point of this benefits of Shodhana, he has explained that Vishuddha Koshtasya Kayagner Abhivardati. So in that Kayagner Abhivardate, the same aligning with the thought process of the total treatment, the Shodhana also plays a major role in bringing this Kayagner Abhivardate or bringing the Agni to the normal status. Thus, generally, it is at the end of this Kaya Agnira Vivardhati, it is a disease-free life and a prolonged life. And then other things are explained like Balam Pushtar Apatyam cha Vrashatam cha Asya Jayate Jaram Krichrena Labate Chiram Jivatyanamayaha Tasmat Samshodhanam Kale Yukti Yuktam Piben Naraha. Very important thing is that it is Kale Yukti Yuktam Piben Naraha. So you are supposed to plan this Shodhana in only whenever it is absolutely indicated. It is not that the haphazardous indication, at the same time it is not the haphazardous way it is being practiced. So it is specifically the indication wise also it should be very particular. At the same time the execution also it should be very perfect. So in that time only you will be having that benefits of all these things. Now, since we are discussing only about this context or the point of Agni, I would restrict my total discussion on only about Agni and its relation with that of Panchakarma, how Panchakarma is going to have effect on Agni and how Agni is going to effect on the Panchakarma practice and Panchakarma outcome. So these are my area of interest and area of explanation. I would restrict myself into only these points. Why I am telling this? Because there are so many explanations about Agni is there. If I be speaking about Agni, I may have to talk about Jataragni, I may have to talk about Dhatwagni, I may have to talk about Bhutagni and all those things. So again, its explanations and its various considerations and all those things. It is a time, since the time constraint is there, because of which I would be concentrating only on few points related to that of Panchakarma. Please bear with me. In that specifically, I have got telling about this one is that there are few important treatments, especially the Shodhana treatments, which has got direct action on Agni. Specifically, when you speak about the Virechana Karma, Sroto Vishuddhi Indriya Samprasado Laguttam Urjo Agniranamayatvam. So he speaks about the Urjo Agni. Agni is being elevated at the end of Virechana Karma. At the same time, Prasrishta Vindmutra Samirnatam, Ruchagni Vriddhi Ashaya Lagavani, Rogopashanti Prakristatacha, so on. So Agni Vriddhi is one of the end effect of Niruha Basti. Once the Niruha Basti is done, at the end you will be doing Anuvasana Basti. In that he speaks about Swapnan Vrittir Laguta Balamcha. Before that he says that Raktadi Samprasadanam. So Raktadi Buddhindra Samprasadho. So he says that there is a Samprasadana of Raktadi Dhatu. Before that it is important to have, or it is important to perform the Niroha Basti. So Niroha Basti and Anuvasana Basti go hand in hand most of the times. It is not a mandatory rule, but it is optional. But especially in conditions wherever the normal circumstances when you are practicing about the practicing the Basti treatment, it goes hand in hand, Anuvasana Basti and Niroha Basti. At the same time, one more Shodhana procedure, that is Vamana Karma. In that also, he speaks about Karmat Kapha Pitta Matan Licha Samyak Bhavitasya Ishtaha Kritva Shamurda Indriya Marga Shuddhav. Marga Shuddhav. So it is a very important point which is being raised here. Marga Shuddha, most of the times we do consider that probably it is a local cleansing. Of course, local cleansing is very essential to bring the Agni into the normalcy. In that condition, specifically, we will discuss these points in the later slides when we discuss about this context of the Vamana Karma. But here, I would like to highlight one point is that at the end of these all Shodhana Karma, the effect on Agni is most of the times it is absolutely seen very clearly, except Shiro Virechana or Nasya. In that Shiro Virechana and Nasya, because it is confined only to that of Jartrurdva. Sometimes it is a Sarvadehika. Of course, I am not generalizing the things, but in general context, what we understand is that Shiro Virechana and Nasya, it affects only on the effect of these kind of treatments generally seen on Jartrurdva only. That's the reason why generally it is not having much effect, much action, much outcome as Agni Vriddhi. So apart from that, rest of all four varieties of Shodhana, what we are generally considering, they all have got this, the end effect as Agni Vriddhi or correcting the Agni. This is very important point to be kept in mind. Having said that, now all Shodhanas have got the effect as the Agni Vriddhi. Then why do we need Agni Vriddhi before treating or before starting the procedure, before planning the treatment of Shodhana? Why do we need? So these all are very big questions that has to be answered. So we will move ahead with our understanding of Agni. When we speak about Agni, are we really considering only when we speak about this Jatara Agni? Specifically, I would confine my discussions only on Agni related to that of Koshta. So in that sthanani amagni pakwana mutrasya rudrasya cha hridayondaka pupusashta koshtamithe vidiyate. In that Agni sthana is also very important one. We do have all this understanding. I am again restricting my discussion only on few points because this is a bigger topic, wider topics. But when we speak about all these things, are we considering only to the understanding of the explanations related to that of hormone, or otherwise are we going to consider anything else? Because when we discuss about the Agni, there are few important points that we need to consider, especially from the point of view of Ayurveda. We have got the explanations related to that of the Pachaka Pitta. Most of the times we do consider Jataragni is equal to Pachaka Pitta, or it is similar to that of Pachaka Pitta. When you tackle Pachaka Pitta, then everything is been done. That is the general idea what generally majority of the people do have. That's why this is the first and foremost understanding what is being explained in Ayurveda. And it is also fair enough also that it is explained that Tatra Pakvamashaya Madhyagam. So the sthana, which is a Grahani sthana, which is being the Agni, are we concentrating only on things? Like when we speak about the Pachaka Pitta, are we concentrating on the secretions which is being there, like hormones, like gastrin is there, somatostatin is there, and then gastric inhibitory peptides are there, cholecystokinin are there. There are so many different varieties of. Are we considering? If the answer is yes, of course, we are considering all these things into our consideration. At the same time, one more important component most of the times we are forgetting is that the kledaka kapha. So this kledaka kapha, which is especially yah punah shleshma amashaya stitah, so it is also present in the amashaya. But when the kledaka kapha increases, pachaka pitta reduces, pachaka pitta increases, kledaka kapha reduces, and there is a homeostatic status that is very important to maintain the agri. In that consideration, we are supposed to consider this kledaka kapha also. What happens if this kledaka kapha is increased to maximum extent? By that any of the treatment or any of the when we are speaking about this agri, most of the times we do forget about this point of samanavata, because the definition of the explanation of this samanavata says that samano agni samipastha koshte charit sarvatha annam grannati pachati vivecheti munchati. It is agni samipastha, but it is not agni. So that is the most of the times we do fail in considering this under the purview of agni. But the thing is that it is in the second line, clearly it is mentioned annam, grannati, pachati, vivecheti and munchati. That shows that it has got a definite role in digestion of the food as well. And there is one more important factor that you need to consider is that this also can be correlated to that of hormonal imbalance, where the slower emptying can also affect the release of hormones involving the appetite regulation, such as cholecystokinin and ghrelin and CCK and ghrelin. There is a relation and it is a movement. Then generally from Ayurveda point of view, we do have to consider one more point. This is Samanavata and Apanavata. These two go hand in hand. Samanavata alone cannot perform all the function. Apanavata at the same time, it is like a relay. Samanavata, from Samanavata, the Apanavata take over, and then it will do its function. In case Apana Vaigunya is there, you can go through all the literatures where Apana Vaigunya is there. In that invariably you will have a Samana Vaigunya also. Invariably, once the Samana Vata Vaigunya is there, Pachaka Pitta Vaigunya is also seen. So they are actually interrelated. So what we need to understand is that these all components has to be taken into consideration when we are speaking about this concept of Agni. One is Pachaka Pitta, second one is Kreda Kapha, third one is Samana Vata, and fourth one is the Apana Vata. So these are all points when we consider, then only we can consider that the concept of Agni and Koshta will be more relevant, because in that Agni, concept of Agni, we do find there are 4 different varieties of Agni, like Vishama Agni, Tikshna Agni, Manda Agni and Samagni. So in that, most of the times Samagni is most desirable kind of Agni, but at the same time the other cannot be neglected. And you will have Vaten Agnir Vishamam Bhavet Tikshna Pittena Mandahat Kafenatu. So these are the explanations. I am not going in detail because this is actually would be a more theoretical version. So that's why I'm just with the background. I would like to explain all these things. Now see this, actually this is I acknowledge the Banaras Hindu University, where under the guidance of Dr. Sangeeta and Dr. Kishore Patwardhan, this PhD work has been carried out make a Agnibala assessment tool, at the same time its validation. So this has been done wonderfully well. Before that, you also know that there are few more works were done in ITRA by Dr. Vasant Patil, and then followed by many of the scholars from Panchakarma. They have done different varieties of tools for identify Agnibala index, Agnibala assessment tool, and different kind of things are done. This seems to be more this Banaras Hindu University version of this Agnibala assessment tool seems to be more comprehensive to me, because this has got all the questions, and then thus you can find out that whether the patient is having Mandagni, Vishamagni, Samagni or Tikshnaagni. This is available in the Google Scholar. It is available. This article is also available. Please go through it. So this is one of the wonderful tool which is being done. So what I mean to say is that identifying the Agni is also very important. In this, relevantly, the questions were asked, like I can read out a few of the things, like what affects, how frequently do you have your meal in a day? How do you describe your ability to bear hunger? That is, your ability to wait for food after you feel hungry. What quantity of meal do you have in a day? So these kind of questions, in that the corresponding answers will give you a comprehensive idea that what sort of Agni do you have, and ultimately you can just make out the assessment becomes very important. Having said that, one more point that has to be considered, which is linked with that of Agni, it is Koshta. So in that Koshta also you will have, they are interlinked. Everything is interlinked as far as Ayurveda explanations are concerned. Agni Chaturvidya Muktva Tadashrayasya Koshtasya Chaturvidhyam Vivakshuraha Koshtaha Kruro Madhya Koshtaha Kruro Mrudur Madhyo Madhyasyatahi Sameerapi. So there are generally 3 varieties plus 1. So there are 4 varieties. In that, specifically in the context of Snehapana, Dhallana speaks about 9 sub quadrants or 9 sub classification of the total Koshta bifurcations. So totally you do have 9 Koshtas practically. So that has to be identified. When it is been identified, then only you can have a, you can give, prescribe and execute the treatment to the maximum extent. At the same time, one more important point is that these Koshtas are also very much connected with that of Agni. Mrudu Koshta is having Tikshnagni, Madhyama Koshta is having Samagni. Then again a question mark. There are different authors have given different idea and different explanations about this one. Some have identified this Madhyama Koshta is having the Mandagni. At the same time, the Krura Koshta is having Vishamagni. In that Vishamagni, there are 2 extremes. Either it may be a Mandagni or otherwise it may be a Tikshnagni, or it is vice versa. Sometimes Tikshnagni, sometimes Mandagni. So this is, everyone knows about this factor. But Koshta is a very important factor that has to be considered. But are we confining only the explanation of this Agni, or considering this concept of Agni, are we connecting only with that of Koshta? Is there any other component which has got influence on this Agni and Koshta that most of the times we practically do not consider? So this is actually my understanding. Some of the explanations what I do, probably it is a debatable, but the thing is that my understanding, I am here proposing some of the things which may be a debatable one. But specifically what we understand is that the Prakriti wise, generally it is understood that Vata Prakriti dominant person is having Krura Koshta, and thus he will have Vishamagni. Pitta dominant Prakriti person, he is having the Mrudu Koshta. This is the reason why he is having Tikshnagni. Kapha dominant person or Kapha dominant Prakriti person, he is having Madhyama Koshta. That's why it may be a Mandagni. Then these kind of things, suppose if you are considering Ekadoshada Prakritis, we do find very rarest breed of these Ekadoshada Prakriti. That's the reason why we most of the times, even with the government of India and the initiative of this Ministry of Ayush also, the Prakriti, Deshka Prakriti Parikshan also, in that questionnaire also, when the questionnaire is been assessed, most of the times you did get the Dvandaja Prakriti only. So this Dvandaja Prakriti, what exactly is the status of Agni, that is a questionable, or maybe it is a debatable one, and it has to be identified. Probably since these 3 are interrelated, Prakriti, Koshta and Agni, then identifying the Agni, invariably you may identify the Prakriti, or identifying the Prakriti, you may identify the Agni, vice versa. identifying the Prakriti, then you can just identify the Koshta. So these kind of works may be very interesting one. So here it is my proposal. Probably this may be the what in my practice what I did get. So this I'm just proposing that Vata dominant Prakriti, you will have Vishamagni, Pitta dominant Tikshnagni, Kapha dominant Mandagni. At the same time, Vata more dominant and Pitta recessive, it is Vishamagni. Specifically in Vishamagni, it is Tikshnagni. Pitta dominant and Vata recessive, it is Tikshnagni. Vata dominant, Kapha recessive, it is a Vishamagni, which is a Mandagni dominant. And then Kapha dominant and Vata recessive, the Mandagni, specifically this Mandagni, more prone for getting a Samavata condition and prone for Vishtabdha Jirna condition. When the person is having the Pitta dominant and Kapha recessive, in that condition, the Mandagni is seen. In that Mandagni, because they are Sasneha, Pitta is Sasneha, Kapha is also Snigdha. At the same time, most of the times, the patient may have this more prone to get Vidagdha Jirna or Samapitta, Haritam Pitam Shavam Pittam Amlam Ganam Guru. Amlika Kanta Hriddaha Karam Dam Sam Pittam Vinidishe. So this is a Samapitta condition, more prone for this. Kapha dominant and Pitta recessive, in that condition, Mandagni is seen where the Sama Kapha is more dominant, more probably patient may have this. And Tridosh, Vata, Pitta and Kapha. Sannipataja. So it is a Tridoshja Prakriti or Sannipataja. You call it as most of the times we do call it as a Tridoshja Prakriti. So it is a Sama Prakriti. So Sama Prakriti will have Samagni. So now question is that this Sama Prakriti and Samagni, how many of patients do have? How many persons do have? It is not that patients always, but how many persons do have, that we need to address this thing. So correction of Agni is very much important. So that's why it is important to identify the Agni and then correcting it. So most of the times what we have is that, we have got this Dashavida Pariksha. In that one very important Pariksha is that Ahar Shakti Tascha Pariksha. So in that also, when we identify, suppose a patient comes to me and I analyze and I find that the patient is having Mandagni. In that condition, of course, we are trying to increase the quantity of Agni. Suppose the patient comes with the Tikshnagni. We are not sure that whether it is a Prakrita Agni or Vaikrita Agni. So that is the dilemma status where you need to identify whether it is a Prakrita Agni or Vaikrita Agni. How do we identify this Prakrita Koshta, Vaikrita Koshta and Prakrita Agni and Vaikrita Agni? Prakrita Agni is something when the patient has, with the memory of a patient, what I understand is, with the patient's memory, when I was perfectly all right, what sort of activity the Agni had? With the questionnaire, the Agni Bala index, or probably the Agni assessment tool which is being there. Just looking at that, two different varieties of the assessment chart you have to fill. One is current status, one is in the healthy status. So it is what I understand is that Prakrita Koshta is also, Koshta assessment tool also has to be done. Like a Prakrita Koshta, when the person was in normalcy, you ask the person to remember when he was in a normal status of health, what was the behavior of his Koshta. And right now, when the person is having some sort of Vikriti, in that condition, you have to again find out that whether it is behaving the same way or not. In case the behavior is different, two different varieties of too much of extreme deviation is there. In that condition, you are supposed to plan for correcting it and bringing back to the normalcy. Suppose in case of a person who is planning for like a, Rutu Anusara Shodhana, in that condition patient is having a normal Agni. In that condition, is there any requirement of bringing the Agni to the normalcy? That is the question we have to answer. So this Prakrita Agni, Vaikrita Agni, Prakrita Koshta and Vaikrita Koshta is also very important. Specifically, treating that one, we do have different varieties of Upakrama. Shadvida Upakrama is there. That Langana plays a very, very important role in that Shodhana Rupi Langana and Shamana Rupi Langana. So these are very important modalities. Yatkinchit lagav karam dehe tat langanam. So bringing about the langana is it the end? That is the question. Most of the times we have to answer. So whether the only Langana will bring the Agni Vriddhi, that the answer is no. Even Snehana also, in the Snehana, Deepto Antaragni Parashuddha Koshtha Pratyagradatur Balavarna Yukta Dridendriyo Mandajaraha Shatayuho Snehopasevi Purusho Bhavet. So it is also very clear mentioning is that in Snehana, the person who Snehopasevi Purusho Bhavet. So daily person is taking the Snehana. It is not that Snehapana, Aravana Snehapana, Shamananga Snehapana, Brahmananga Snehapana I'm talking about. But even Snehana Chikitsa, the Abhyantara Sneha, person is taking the Abhyantara Sneha, maybe at 10 ml daily or 50 ml daily. So that is up to the patient. But person will have Deepta Antaragni. At the same time, there is a Rukshana Chikitsa also. You see, Mamsala Medura, Buri Station, Vishamagneha. Snehochitastaye snehastan puram rukshayet tataha. Specifically, he says that some sneha shodhayed eva sneha vyapad na jayate. So sneha vyapad na jayate. This is the reason why rukshana is also having similar effect. Surprisingly, this rukshana and langana, they are having a similar samyak langana chikitsa is similar to that of samyak rukshana chikitsa. And the Samyak Shamanrupi Langana Lakshana is also similar to that of Samyak Shodhan Rupi Langana Lakshana. So they have got a similar action. It's very important. And most of the times we do consider this reference of Ashtanga Sangraha stating that Snehasya Panat Purvascha Datavyam Mrudu Beshjam Uttejanam Hutashasya. Most of the times we do consider this, that in Panchakarma, before Panchakarma, you are supposed to plan for this one. Especially from the point of view of Snehana, this the Uttejanam Hutashasya, so it is very important. Mrudu Beshajam. So he said that when we speak about Beshaja, then also again you have to think about three varieties. Kalpasthana talks about three. Mrudu Beshaja, Madhyama Beshaja, and Tikshna Beshaja is there. So there are three varieties are there. Here he speaks only about Mrudu Beshaja. Will that be considered as the ideal, suitable drug for all the conditions? That again we have to think about. And also he Ashtanga Hridayakara also talks about there are different varieties of conditions where the Pachana and the Deepana, both of them are indicated. Samshodhana, Tatra Samshodhana, Histavulya Bala, Pitta Kafadikan, Amadoshan, so on. So he explains about the Pachana Deepana. So Pachana Deepana, that's the reason why most of the times we do speak about Pachana and Deepana only when we are speaking about bringing the Agni to the normalcy. Fair enough. There is no doubt about this one. But Pachana Deepana plays a major role in certain conditions. Specifically, you are aware of all these things that Pachati Yat Tat Hi Pachanam Nagakeshravat. So on the Pachana, which has been explained, and Deepanam Jataragni, Deepanam Yata Gratadihi. So Grata is also having the Deepana action. So you do have multiple varieties of drugs which are explained. So most of the times it is been misinterpreted that even for Deepana Pachana only Ruksha Dravya has to be given. Even a Snigdha Dravya is indicated. So there are different varieties of things are there. We'll discuss in the coming slides. Assessment wise, you have to have this, as I explained, this Samyak Yoga of Langana. Ati Yoga of Langana. He said that in Samyak Yoga it is Kshut Pipasa Sahodaye. And in case of Ati Yoga it is Agni Bala Nashashta. So Ati Yoga of Langana, too much of say that, okay, most of the times we do have the thought process that you do excessive Rukshana. Because I want to lose weight, the patient wants to lose weight and do excessive Rukshana. Patient wants to lose weight, you do 2-3 Shodhana one after the other. Patient wants to lose weight, you do Sadhya Shodhana for 2-3 consecutive days. I've seen there are so many people who are practicing these kind of practice that within 10 days all Panchakarma will be done. What would be the status of body when we are doing these kind of practice? This is what is the outcome of this. He said that Deha Agni Bala Nashascha, Deha Bala Agni Bala Nasha. So it is a Nasha. So ultimately you will have a problem. So now let us understand these kind of core understanding. What these all are actually in future slides I would be speaking my understanding on how do I assess and how do I plan for these kind of Agni, increasing the Agni in different kind of persons with different koshta. So I personally consider the koshta into the 9 quadrants, and then you have some guidelines. Based on the guidelines, you have to plan for the treatment. That is very important, because when we do not follow the shastra, then probably we may go here and there, and we may brand that practice itself as a standard practice. But these practice are what I do practice based on the shastra knowledge, what I read and understood. When we speak about the Mrudu Koshta, just imagine the Agni, what is being explained as Tikshnagni. But when we speak about Mrudu, Mrudutara, and Mrudutama, all the 3 conditions, your Agni will be same, Tikshnagni. In that Tikshnagni, what sort of Tikshnagni, whether it is a Tikshnagni, Tikshnagni plus, Tikshnagni plus plus. So these kind of things we have to identify. Based on that, what sort of changes does the body have, because of which the person possesses these kind of this kind of koshta. That is a very interesting factor. Why I retrospectively I understood this one as the guna plays a very important role. Today happens to be Mahadevam. There is one seminar which is going on in Kanyakumari. The person who has propagated, re-established the concept of guna. I remember Dr. Mahadevan, L. Mahadevan, for his contributions. Guna concept of this one says that this Mrudu Koshta is having Ushna Guna 1 plus, Tikshna Guna and Saraguna. Similarly, Mrudu Tara and Mrudu Tama will have 2 plus and 3 plus. Then only that becomes that Tikshna Tama. In that condition, you have to identify what sort of drug you would be planning, because all Mrudu Koshta, if you are planning for same drug, same formulations, then that will have a problem. An example now, the Deepana, I am just talking about the Deepana. In that specifically, what sort of rasa, what sort of guna and virya and vipaka, which is what is to be selected in this condition, because naturally it should be, may not be completely contradictory, may not be completely complementary, then it should have some sort of combination that we need to talk about, is that the Deepana Dravya must possess Tiktarasa and Anushna Virya, Madhura Vipaka and Bedana property. I understand that the patient comes to us because this concept is very relevant to me, because in the context of Kalpasthana also this is explained very clearly that Krura Koshta and Deepta Antaragni, in these conditions, you are supposed to plan for the Anuvasana Basti, prior planning for Virechana. This is the relevant explanation you do find from 12th chapter of Kalpasthana. At the same time, you do find different context. He says that Ati Tikshnagni is there. You are supposed to reduce it to certain extent and then plan for the treatment. Otherwise, this is going to have a more problem. An example is that now, because this Saraguna, which is very important, see, Mrudu Tama Koshta is having too much of Saraguna. That's the reason why person will have more loose stools. In the assessment of Koshta, I say that you give Kshira, and that Kshira, if it is administered to Mrudu Tama Koshta, 1 glass of Kshira, person will have 2-3 loose stools. That shows that Saraguna is too much prevalent in that Koshta. That's why against to that we have to think about the assessment and the administration of drug. Again, here you have to plan for, most of the times you have to plan for, because this is a Sasneha. Agni is Sasneha, Pachaka Pitta is Nasneha. So most of the times it is a Ruksha, relatively Ruksha kind of Kalpanas are very important. That's why, again, I make it very clear that the Kalpana plays a very important role, right from the Lagutama to that of Gurutama. So you are supposed to plan for or select only those drugs which are having the particular guna, particular, specifically guna related to that of Lagu or Guru. So Tikshnagni, definitely that has got more capacity to digest. That is a different matter. So it is a churna if you are planning for. In Mrudu Koshta, most of the times, Guduchi, Katoka, Tikta, Swadupaka, Rasayani, Sangrahini, Palayusna. Agni Deepani. So it is actually the Guduchi is Agni Deepani. So we are speaking about Deepani and Guduchi go align with this Mrudu Koshta. Paniya, specifically there is a Panchakola Paniya, specifically you have got Deepaniya Gana. And there are different varieties of Deepaniya Ganas are there, like the Pipalyadi Gana is there, Shatahvadi Gana is there, and then you will have the, in that Deepaniya Gana, you will have this Panchakola is one of the, few ingredients. So in that Paniya, what I understand, the Paniya, because it is not the Kalpana, what I generally do not prefer the Fanta preparation just because it is Ushna and Tikshna when you are using with that proportion. What I say is that Paniya is very simple. Take 10 grams of Panchakola churna and add it in 1 liter of hot water and then use it. The quantity is only this much I use, and this paniya throughout the day whenever the patient feels thirsty, this is being administered, and this is found to be very, very beneficial, and it is non-irritant. If you see that Panchakola Fanta, if you prepare as per the Shastra, you give it in Mrudu Koshta, then it is going, you will have a problem with the burning sensation in the retrosternal region. Kashaya, when you are thinking about this Mruduttama, you have to have a Kashaya. Kashaya, now here the concept of Bhedana comes. Then the first two, the Bhedana concept is not that much relevant. So Amritottara Kashaya, it is a Guduchi and Shunti and Haritaki. So specifically it is in the increasing order. So Haritaki is, and it is explained that Anlomana, it is a Kritva Pakam Mananam Yatpitva Bandhamadonayet. Tachanlomanam Jayam Meta Prokta Haritaki. Paritaki is a Anlomana Dravya. At the same time, Arogyavardhini, specifically this Arogyavardhini Rasa also, it is having a Deepanapachana property. So specifically, if you see the reference of Arogyavardhini, surprisingly, it is having this Deepanapachana property because it is having most of the times the most quantity of Katuki is also there. So Bedana effect is important when Dravataha Vriddhi of the Pitta is there. In order to remove that, it is very important to have these kind of formulations for maintaining the bringing back the Tikshnagni to the normal Samagni level. There are different formulations like Rajanyadi Churnam, Hutabugadi Churnam, and Mustarishtam. With the caution, you can just plan for Mustarishtam as a Deepana Dravya or Pachana Dravya because Mustarishtam is having Shita, Shita Virya. And Mrudu Koshta again, when you are speaking about Pachana Dravya may have this Katurasa, Tiktarasa, Anushnavirya, and Madhura Vipaka, and Vedana. Vedana, it's optional again. So this here, Mrudu Koshta, Churna like Shunti Churna and Musta Churna can be selected. In Mrudu Tara Koshta, Paniya like Nagara Paniya and Dhanya, Nagara Dhanyaka Paniya. So this is actually this Nagara and Dhanyaka Paniya, which is there in the context of the Anuvasana. The Anuvasana, when a person is administered with Anuvasana, this Jala is being recommended for every patient who are having this Anuvasana Basti. And Shadanga Paniya, Mustaprapatakoshira Chandano Chanagarihi. So specifically this is Pipasa Jurashantayi. So he says that Pipasa Jurashantayi, but at the same time it is also having Musta and Shunti also it is having. So this is also kind of Pachana Dravyas are there. So this Pani also is very important in case of Brudutara and Brudutama. It is Swarasa. Specifically, it may not be a Swarasa, but Lavanardraka Prayoga. Specifically, Lavanardraka, when you take a smaller quantity of Lavana and smaller quantity of the Nagara and Ardraka, then you just keep it on your mouth and just slowly chew it, and then the rasa will go. And this is from Vaishya Ratnavali. He explains about this one. This is also having a Pachana effect. And Shunti Jala, specifically Shunti Jala, again, smaller quantity of Shunti Churna and larger quantity of hot water, which will have the Pachana effect. When you speak about Madhyama Koshta, here the Agni, again, it is specifically understood as a Samagni or Mandagni, so based on different people. But guna-wise, Madhyama Koshta, people will have the Ushna, Tikshna and Snigdha. Madhyama Tara Koshta, it is Ushna, Tikshna and more Snigdha. And Madhyama Tama, it is having more Snigdhata. So that's why it is important to have this one, the Pachana and the Deepana Dravyas having more dominance of Katurasa and Katuvirya, Katuvipaka and Ushnavirya. So specifically these kind of drugs are indicated. Churna formulation for Madhyama Koshta, it is Agnimukha Churna and Ashtachurna. Specifically, I was just talking about this concept of Samanavata. Now onwards, the concept of Samanavata and Apanavata comes into picture because Madhyama Koshta onwards, Madhyamatara, Madhyamatama onwards, will have a problems related to that of the bowel habit. So that's why it is this Madhyama Koshta, it is Ashtachurna is Hingvashtaka Churna. So it is Pratama Kavale Bhukta, Grita, Yukta. So it is a Samana, Pratama Kavala Bhukta, it is a Samana Vaigunya. You are supposed to administer this one in Pratama Kavala Bhukta. So that is what is being explained here in this, and Grita. So it is having the Deepana action at the same time Pachana action. What happens if this same Ashtachurna is administered in case of Mrudu Koshta and Mrudutara and Mrudutama? Patient will have nauseating effect because it is having Hingu. So this actually specifically that has to be utilized in case of Madhyamatara and Madhyamatama. Paniya, Panchakola Paniya, or maybe Panchakola Fanta you can use in this condition. And I prefer this Shankavati specifically because it is having some sort of Kshariya property. The drugs which are having Kshariya property, those all things can be utilized in case of Madhyama Koshta because that is having Mandagni, that is having Tikshna, Snigdha Guna. More Snigdha Guna is there. That's the reason why it is having the the Kshara property drugs can also be utilized. So Kashaya wise you can have Amritottara Kashaya, or otherwise you can have Nagaradi Kashayam. Here Pachanamrita Kashayam or Nagaradi Kashayam, which is more Tikshnata. Of course, this Amritottara is utilized for the purpose of the Mrudu Koshta. Here Nagaradi Kashayam and Pachanamrita Kashayam will be more utilized here. And Agni Tundivati, specifically if you are using these kind of formulation which are Ushnatikshna in property, Vavai Vikasi property, at the same time it is having the capacity to increase the Agni, which is more towards the Madhyama variety of like what I explained, that Mrudu, Madhyama and Tikshna Dravyas are there based on their guna. So the Madhyama variety of drugs can be used for Madhyama Koshta. There are different formulations like Ashtachurna is Agnimukha Churna, and then it is Mahashankavati is there, Panchakola Churna, there are explained. And Krura Koshta, you will have a Krura Koshta, then Krura, Kruratara and Kruratama. In that Vishamagni is there. So Vishamagni, all Vishamagnis are there, but specifically Guna wise, Krura Koshta will have Ruksha Guna and less Chala Guna. Kruratara Koshta more Parusha Guna and less Chala Guna. And Kruratama Koshta is having more Khara Guna and less Chala Guna. So these are very important. Based on the base of all these Guna identification is retrospective. It is an Anumana Pramana. Based on the bowel habit, based on the Agni, quality of Agni, and based on the signs and symptoms which person generally do get. Kruratama patient will have a bowel habit once in 3 days, 4 days, and it is hard and impacted stool. So Kruratama is having more Khara Guna and very less Chala Guna is seen in this. So ultimately, what are you supposed to plan for? Because here also there are two extremes. One is Mandagni and Tikshnagni. Sometimes Tikshnagni, sometimes Mandagni. So there is a fluctuation because of Vata influence on the Koshta. And then Pachana Deepana, what sort of drugs you can just administer is that Katurasa Pradhana Amlarasa. So specifically, if you search in Shastra, you do find that Deepaniya Dravyas and Pachaniya Dravyas, specifically Deepaniya Dravyas, you do have dominance of Amlarasa, at the same time the Katurasa. This Amlarasa specifically can be more useful in case of Krura, Kruratara and Kruratama. Specifically, there are few, because it is a Rochana property is also there, so that is also a very important factor that has to be considered. Katuvirya, Katuvipaka and Snigdha Guna and Ushnavirya. So these are very important, the basic concept based on which the drug has to be selected. In that Krura Koshta, patient may have problem defecating, at the same time Agni is Aham Vaishwanaro Bhutva Praninam Deha Samashritam, says the Vaishwanara. But Vaishwanar Churna is having Manimantha, that is Haritaki is having 12 part in this, Haritaki and Saindava which is there. So that Yeranda Brashta Haritaki, which is also very important formulation, most of the times we may not find the explanation of this one as a Deepana Pachana. But Vaishwanara Churna, when Vaishwanara Churna, when it is the Eranda Brashta Vaishwanara Churna which is given, that also is very useful in this case of increasing the Agni, Pachana, and doing Pachana and Deepana in case of Krura Koshta. So specifically Asava like Ardhra Kasava and Panchakola Asava, specifically these Asava preparations are having Amlarasa. So it is the Amlarasa Pradhana, Katurasa Pradhana, Ushnatikshna property, Vyavai Vikasi property, all those things has to be utilized here. Specifically in case of the Krura Tarak Koshta, an example is Arishta, like Takrarishta. Takrarishta, though Takra is Ruksha, but Takrarishta is utilized in the context of Grahani Adhikara which is there, and Chitrakadivati. Of course, this most of the times is one of the most favorite drug for Pachana and Deepana in case of among all the Ayurveda practitioners, Chitrakadivati. I do have some sort of thought process related that of the Chitrakadivati, because Chitraka is similar to having similar properties like that of Danti. And only the difference between this Danti and Chitraka is that Chitraka is more Ushna and Tikshna, it is Pachana and Deepana. At the same time, Danti is Anulomana. Chitrakadivati, when it is given, in case of Mrudu Koshta, it is creating more problems to the patient than giving the benefits. At the same time, this is more relevant to that of Krura, Krurutara and Krurutama. To certain extent, even Madhyamatara, Madhyamatama Koshta also in a lesser dosage that can be utilized, because this is having Ushnatikshna property and mild Anulomana property. This is having, the Chitraka is having. That's why the Rochana and Pachana and Deepana property is also very important, and Grita wise. So here the utilization, because Grita in small quantity, it is understood that this is Deepana. But specifically, if you search Shastra, you do find some formulation like Dadimadi Grita, which is having the Deepana property. And in case of this Kruratara Koshta and Kruratama Koshta, this can be utilized. Of course, Kruratara Koshta, you can also utilize Indukanta Gritam, which is also one of the very important formulation from the Gulmadhikara, that also can be utilized here. But it is not having the Anulomana property, it is a Deepana property, and Vatanulomana property only it is having, not the Anulomana like Kritwapakam Malanam, it is not having. But that can be utilized along with some other formulations, definitely that can be utilized. In case of Kruratama, Gandharvhastadi Kashayam, along with Guda and Saindava, that is been relevant in case of Kruratama, because it is a Deepana Pachana. At the same time, it is also having the Anulomana property. And specifically, Grita like Sukumara Grita. Sukumara Gritam is having it is not having the Deepana Pachana property altogether, but specifically it is a Yamaka Sneha, which is having the Grita and Eranda Taila as the ingredient, main ingredient of this one, that can be utilized with other formulations like Chitrakadivati. Am I audible?
Yes, sir. Yes, you are audible.
Yeah. So Chitrakadivati, along with this Kumara Grita, when you are planning for this kind of administration, that is having very good effect. At the same time, what is like Kravyad Rasa is also very important one, because it is Ushna Tikshna, and it is a Tikshna property which is going to have action on this one. Now, understanding is all things. Now you might have understood one point is that in Mrudu Koshta I have made two bifurcations. One is Deepana, separate for Pachana. But in case of Madhyama Koshta, it is Deepana and Pachana together, and Krura Koshta, Deepana and Pachana together. Specifically in case of Mrudu Koshta, everyone has to be very careful, because Deepana drugs may not do the Pachana to larger extent. Pachana drug may have some sort of action on Deepana, but it may create some problem if you are planning only for Deepana, Pachana alone. So Pachana and Deepana go hand in hand, of course, but you have to be very careful. That's the reason why there is a one difference between these Deepana and Pachana, is that there only Tiktarasa is indicated in case of Deepana. In case of Pachana, even Katurasa is also indicated with caution, because it is a Madhur Vipaka, and Anushna Veera Dravyas can be utilized. So that's the reason why there are two bifurcations in case of Mrudu Koshta. In case of Madhyama and Krura Koshta, there are no bifurcations. Influencing factors are very important. Diurnal changes, seasonal changes like Grishma Rutu, Agni, decreases. Hemant Rutu, Agni increases. In Hemant Rutu, Agni increases, but bowel habit, there is a problem. So in case bowel habit is having a problem, again, in turn, it will have an action on the Agni and it will have a negative impact on this one. Sama condition, specifically, that's also a very important factor that has to be considered. Disease, what sort of disease are we treating? Are we treating diseases of gastrointestinal tract, or otherwise it is from the periphery? Periphery diseases may be very easy, especially when we are speaking about the Deepana and Pachana concept and identifying as well as correcting the Agni. Then diseases of Madhyama Roga Marga and Bahya Roga Marga, it is almost very easy. But in case of the person who is suffering with the Abhyantara Roga Marga, like in case of irritable bowel syndrome, person may be having if you correlate as a Pravahita, or it may be correlated as a Vata Jagrahani. So in that condition, it is quite difficult for identifying the Prakrita and Vaikrita, and how to correct this one. Without correcting, how do we go ahead? So these all are the questions that has to be answered. Chronicity of a disease, the disease when it progresses to larger extent, then the Agni decreases. Concurrent medications, most of the times you do have concurrent medications. In today's day, the pantoprazole kind of the proton pump inhibitors are administered, and it has been counter-sold from many of the chemists. That has created lots of problems related to that of Agni. Of course, there are side effects, adverse effects, but specifically from today's discussion point of view, I would say that the assessment of Agni becomes very difficult when the person is already on pantoprazole for months together, years together. So it is very difficult to identify what sort of Agni person is having, what sort of Koshta person is having. So psychiatric disorders, you cannot ask the person, and person is not in a position to express his ideas and express his reality, or what sort of changes are there with the Agni and all those factors. Then it becomes very difficult. Pediatric age group, of course, Swatantra and Paratantra Bhala are there. So in case of Swatantra Bala, to a certain extent we can identify. Paratantra Bala, of course, we cannot identify, because parents also can give some hint, so it becomes very difficult. In case of Sama Dosha, as I said, the influencing factor in that Sama Dosha, there are few important drugs which are there, very easily available drugs that has to be utilized as far as my understanding is concerned. That is Samavata, like Shunti, and Samapitta, it is Pippali, and Sama Kapha, it is Maricha. Specifically, these are available, the references are available in the Shastra as well. So because of their property, these three drugs are wonderful drugs, especially in treating the Sama condition of the dosha. And the different varieties of formulations like Kalyanaka Kshara. So this is Kalyanaka Kshara is one of the Kshara, you can just see in the Falashruti also, you can see that it is Meha Pliha. Ruja Ana Shwasakasam Chanashiyet, in that also specifically Udhavartahara and Vibandhara and Arshahara, Gulmahara, Pandu, and all those things. Specifically, this Kshara preparations are good, as I said. These kind of Kshara drugs can be utilized along with some other drug. In case of the presentations are like Gulma. Presentations of Koshta, like Madhyama Koshta, Madhyamatara, Madhyamatama Koshta, can be utilized. Gandharvhastad Kashayam, also it is called as Pati Kashayam, which is generally utilized in case of the traditional practice like Pirichil, the Taila Parisheka, Sarvanga Kayaseka or Sarvanga Taila Parisheka. Specifically, these drugs are utilized even after that. Every day that has to be administered, even after Nyavara Tepa and Nyavara Kiri. So it is actually Shashtikashali Pindasveda and Shashtikashali Annalepa, as well as the specifically it is spiritual or the Taila Parisheka, Sarvanga Taila Parisheka. This is one of the very important formulation that has to be utilized. So this also has got a very important role in tackling Sama Dosha. Specifically here I am just talking about the Sama Dosha. In case of Kapha, Kalyanakshara can be utilized. Other conditions, Gandharvhastad Kashayam, directly without thinking much, you can utilize. There are dilemma status. Guna wise, there are dilemma status like Urdu Gamla Pitta, you will have Ushnatikshna and Snigdha, and Ado Gamla Pitta, you will have Ushnatikshna and Saraguna dominance. In case of Amatsara Snigdha and Saraguna dominance, and in case of Niramatsara Rukshaguna and Saraguna, based on the Guna, you are supposed to plan for the correction of Agni, which is very important. Now the question is that are we done with the discussion of Agni? When we are speaking about the Deepana and Pachana, if Deepana Pachana is all, the treatment is complete with Deepana Pachana, why the other treatments are essential? Questions comes when the person is having excessive problem. So it is alpe langanam, madhyame langana pachanam, prabhote doshavasechanam. So these kind of explanations give a very clear picture about the correcting the situation. Now an example is that ajirna. In case of ajirna, a person is having problem related to that of the kapha dominance and harlasa praseka is that annava srotas is involved. In that condition, correcting Agni, if however amount of Deepana Pachana you give, however amount of the tablets and churna and kashayams you give, it is not going to get cured. But in case of excessive ajirna, especially the ama ajirna, you are supposed to plan for prachardhana, you plan for sadhyo shodhana. The concepts are very clear from the different references you do find. Jurakaran budai Omyanam Omanir Harit, Kafapradanan Doshan, Utklistan Amashestitan. So from that, the Prachardana is done, immediately the Agni will increase and the person will have normalcy. In case of Kamala, most of the times I understand that many of the practitioners do practice this Mruduvistiktakaihi Kamali to Virechanihi. Most of the times the explanations are understood as Mrudu Shodhana, Mrudu Virechana. But with this going behind the concept, I just thought there are different references are available. Kamam na lati iti kamala kama, person is not having a desire to eat, person is not having appetite, person is not having any agni. Then if you are giving any virechana aushadha or maybe sadhyo shodhana also aushadha if you are giving or nityarechana aushadha if you are giving, grahanim achadayati, gurutvam apadayati, there are references. Atisaram janayati. So it will have a problem when you are doing this kind of administration. So in this regard, what I did is that long back, maybe around 10-15 years back, I thought the hepatocellular jaundice patient came and there is absolutely zero Agni. And how do I plan for treatment? Neither the oral medication is not yielding much result. You have to plan for Shodhana. Then I thought that why can't I plan for Vamana? So then Vamana I planned Sadhyo as a Sadhyo Shodhana, thinking that it is actually the problem related to that of Sama condition. Haritam Pitam Shavam Pittam Amlam Ganam Guru, Anim Amlika Kanta Hrdakaram, Samprittam Nirdishet. So symptoms may not be really similar to that of Amla Pitta, but also the Agni Mandya was seen. Based on that, I just did it. And to my surprise, after I did it, I gave the Panchakola Paniya to that patient. And the patient had a wonderful Agni immediately after this one. On the day of Prachardana, the Panchakola Paniya was given for whole day and the person had a wonderful Agni. And later on, I started with the Snehapana after giving a 2 more day of Deepana Pachana, and then the Snehapana I started, and then I did the Shodhana classical Virechana, and by the end, to my surprise, actually I did check the bilirubin level, total bilirubin, direct and indirect, before the Prachardana, after Chardana, and after Virechana, and the bilirubin was around 7, and by the end of 1 day of Chardana has reduced it to 4, and at the end of Virechana it has reduced to 2, and then Aushadhi was given, and within 15 days patient's Kamala was not. So then later on I just followed this protocol. Is a wonderful protocol, especially in case because it is not Ruddapata Kamala, it is a Kostashrita Kamala. So in that Kostashrita Kamala, though Shastra talks about the Mruduvistiktakai Kamali to Virechanahi, probably we have misunderstood the concept, and the Avastika Chikitsa was required, and wherever the Avastika Chikitsa is required, where the Agni is completely low or completely nil, in that condition it is better. After screening the patient, of course, I am not giving a clear verdict, but most of the cases it found to be very wonderfully working in that condition. Specifically in case of Vibandha also, Purishava Srotas also, Agni, correcting Agni, if you are giving Ruksha Nityarechana, it is not going to help. A person may have problems related to that. In case of Udavarta also, Agni Mandya is seen that Pakvashya, Shodhanavasti is indicated. In case of Grahani also, it is involving the Mahasrotas. And in order to increase the Agni, no doubt oral medications may help, but there are different varieties of drugs. Grahi bastis are there, Deepana bastis are there. Specifically, Erandamuladi basti, Erandamuladi Kshar basti is considered as a Deepana basti. Grahi basti, so it is actually the Ambashthadigana. Yukta, Kalka Yukta Basti, which is being considered as Takra Yukta Basti, it is also considered as a Grahi Basti, and Grahi Basti will increase the Agni. That is what we are supposed to plan for. And Amavata, in case of Amavata, Rasavasrotas and Medavasrotas, Rokshana Chikitsa is a very, very useful, treatment. And even for that matter, Chardana Chikitsa or Prachardhana, Ullekana Chikitsa is also very, very useful in case of Amavata, provided the condition arise where the Agni is nil and the person is having all the signs and symptoms of Amavata. No doubt in Amavata Chikitsa it is not explained, but specifically that is very important. Had this directly, if you would have gone for this Kamala and Amavata directly, if you are doing the Deepapachana and if you are planned for the Snehapana and then Shodhana, then probably the outcome may be for instantaneously, it may find some sort of relief. But later stage, same problem of Grahanim Achadayati, Gurutvam Apadayati, Atisaram Vajanayati, all those conditions may be seen in the later stage. That's why you have to be very careful in that. Another context is that the Madhumeha with Ajirna, in that what are you supposed to plan for? Rukshana with Chardhana, or these kind of examples are just given to make the people understand that it is not only the Pachana and Deepana. Pachana and Deepana alone are not the end of the correcting Agni in case of the Panchakarma. Specifically, when you are planning, as I said, in case of Kamala, one Shodhana followed by another Shodhana is also a very good protocol of treatment in order to correct the Agni and in order to bring the Agni into the normalcy and treating the case successfully. That's why these kind of thought process we must develop. So all the Shadvida Upakramas, in majority of them, in Avastika wise, if you are utilizing it, this is going to be very useful for the patient because it will be more ethical consideration. Moving on to the concluding this session, I would say that there are a few take-home points. I would say probably everyone is a practitioner, so everyone knows about everything. So, but just out of my experience, some of the points I have just made that Dhatu Samya is motto of the treatment, as everyone knows that should be the motto, and assessment of Agni is at most important. And the Panchakarma plays a major role in correcting the Agni, though Pachana and Deepana are very essential. Rukshana also plays important. Snehana also is important. Svedana is also important. Other things, but Avastika Chikitsa and Panchakarma also plays a major role. Correcting Agni is optional or mandatory prior planning Panchakarma. This is what is my understanding, is that most of the times without Deepana Pachana you cannot plan for Panchakarma. That is a general rule, and that general rule you can break, as I said, that in case of the Navajwara Chikitsa, if you are planning for the Vamana, then that is not actually, you are not planning as per the general rule. In case of Tamaka Shwasa, Tamaketu Virechanam he says, but Tamaketu Vamanam is also there. So it is Avastika Chikitsa. In that Avastika Chikitsa, if you are planning, then definitely it is going to be yield a very useful outcome. So you have to have a open mind and you have to observe each and every patient very closely so that you can plan the treatment very meticulously and you can execute it properly. Selection of Pachana and Deepana is based on Koshta. That's why I generally prefer this formulation, what I just said, just an example. You can just elaborate from that point. Of course, my thought process says that this is how I select, because this is the way I understand the Koshta and this is the way I understand that Deepana Pachana can be done and which will be useful without any hassles, because mismatching, selecting a drug in a non-indicated Koshta will lead to more problems than giving some sort of benefits. That's why it's very important. When the Koshta is having more snigdhata, you have to use Ruksha Dravyas. When the koshta is having ruksha, an example is that person is having krura koshta. So are planning only ruksha dravyas. Like I said that churna in the Vaishwanar churna in the form of Saindava, it is having stigdhata. And when you do the Eranda Taila Varjana, it is having a stigdhata. Now the stigdha dravya, which is having anulomana property, at the same time the property of that one is being changed, so it is going to act on that particular koshta, so it is very important. Selection of formulation and Kashaya Kalpana are at most important. We cannot select a particular thing like haphazardly, like a Fanta Kalpana in every patient, Asava Kalpana in every patient, Churna Kalpana in every patient. Of course, Gurutva and Lagutva plays a very important role in identifying the variety of Deepana Pachana Dravya that has to be selected. Selection of Sadyoshodhana to be considered in various certain avastha. That's very important. So this is a take-home point from my presentation. So I think I have comprehensively covered the topic. Thank you very much for your patient listening, and hand over the mic to the organizer. Thank you, ma'am, for the opportunity. Thank you.
Thank you, sir. Thank you so much, Professor. It was very elaborative and very knowledgeable. And really, I appreciate the clinical application of Agni you have explained. Of course, those who have joined online and our students, they are benefited with the concept of Agni in Panchakarma in real sense, the application in clinical sense. So, of course, really, thank you so much, sir, on Department of Panchakarma. Thank you.
Very much.
And it was really a very good. I think if anybody having question, they can ask or they can put in the chat box also. But really, the Prachadana and Avasthika Chikitsa, it was wonderful explanation by you, sir. Thank you so much.
Thank you. Thank you so much. Thank you.
Yeah.
Thank you.
If anybody is having question, they can put in or they can raise the hand. I think so it was so elaborative. So no questions from the, of course, some teachers and some Panchakarma scholars have joined online also. There are questions.
Thank you so much, ma'am, for your the opportunity. The opportunity is very important. Thank you very much for this opportunity, and hope I have done the justice to the topic. Thank you so much.
Yes, sir. Yes, sir. The thing is, like everybody talking about Panchakarma, the authentic Panchakarma, classical Panchakarma has not yet been, like many people do the Vamana, like where they needed classical Vamana, they do the Sadhu Vamana, or they modify the Vamana according to the patient or according to the avastha. So that's why, like, I thought, okay, they're like for the students, those who are doing clinical practice, they should be known what is the classical Panchakarma. That's why we started this case series, sir. Okay. So thank you, sir. Thank you for joining. And
thank you so much.
Thank you, sir. Namaste, sir. Thank you all for joining. And now this is the end of the session. Thank you, everyone, for joining.